we've recently undergone a name change. So we were known as iCope Islington and iCope Camden. I see a couple of you nodding. We are exactly the same service. We're just now called Islington Talking Therapies or Camden Talking Therapies. So, what are we? We are a talking therapies service that offers psychological therapy for anxiety and depression. It is short-term, quite structured therapy. It's usually cognitive behavioral therapy, but we also offer some other therapies that I would welcome talking about at the end. So we're a primary care service. So what that means in practice is that you can self-refer to us directly, or you can have your GP do a referral on your behalf into our service, or any other professional can do a referral. Who do we see? So we offer two kind of broad treatment pathways for anxiety and depression. So step 2 is our kind of low intensity service. So we would offer more immediate help, but it would be a kind of a shorter course of therapy for more kind of mild anxiety, depression, or chronic stress. So that would be around 4 to 6 sessions, but you could get those 4 to 6 sessions quite quickly. But Lucy will talk more about that in a minute. We also offer a full course of therapy at what we would call step 3. So that's for more complex anxiety presentations. So you might have heard of post-traumatic stress disorder, obsessive compulsive disorder, panic disorder that is more complex, or agoraphobia, where it's difficult to leave the house because of fear, or other kind of phobias. So we would offer both those two treatment pathways, but one of them has a shorter wait and it's for more mild symptoms, and the other one is a more in-depth therapy, but it has a longer waiting time, which I'll be completely transparent about in any questions. What we don't offer at our service, we are not a secondary care service. So we don't offer treatment for things like psychosis, schizophrenia, eating disorders, bipolar affective disorder, and personality disorders. That is because, or dementia, there are services available, but that is because usually these kind of presentations need a multidisciplinary team approach. So that is when you would have psychologists, psychiatrists, social workers, maybe occupational therapists, all under one team. So we don't offer secondary care services. We can refer on to secondary care services though, as can your we really want to see people, we really would like to see people quite quickly when they're experiencing the first signs of a change in their mental health. So that might be something like a major life transition, after a major life transition, or loss. That can be loss of identity through like something like retirement, or different family dynamics, or loss of a loved one. We can also refer to bereavement counselling as well. So these are some common kind of signs of a change in mental health. You might notice withdrawing from family and friends, a loss of interest in things you used to enjoy, becoming more irritable. It's very hard to be out of your head, worrying about things, changes in sleep and appetite, and struggling with transitions. We would love to help with all of those things quite quickly, and I'm going to give it to Lucy to talk about those.
I'm going to talk about what we offer at step 2. So that's our kind of lower intensity cognitive behavioural therapy. So it's a treatment called guided self-help, which teaches cognitive behavioural therapy tools. So by that I mean, with CBT, it's thinking about your situation at the moment and how it's kind of having an effect on your thoughts, emotion, your behaviours, so how you cope, as well as physical symptoms as well, and how that can create feelings of anxiety, depression. And guided self-help teaches kind of self-help materials, so you'd be guided through those with a wellbeing practitioner. Usually we would be treating anxiety, depression, phobia, panic disorder, and also stress and sleep insomnia as well. So usually there'd be 30-minute sessions on a weekly basis. We'd offer between sort of 3 and 6 sessions. They'd usually be quite structured, so we'd be going through tools in the sessions and giving you kind of small tasks to complete in between the sessions, just to kind of apply those to your day-to-day life. And what we hope to try and do with that, as has already been mentioned, is kind of thinking about that early intervention. So if we are starting to notice that we're feeling unwell, we're feeling a little bit anxious, trying to basically try and help you to support yourself to manage those symptoms, to prevent any further deterioration or those symptoms from worsening. And we try to be as accessible and flexible as possible. So we can deliver sessions over the phone, video, face-to-face sessions as well. And we try to be as flexible as possible as fitting it around your schedule. So we can accommodate that as well as using interpreters. So we offer kind of longer sessions if an interpreter is required. Alongside of our guided self-help, we can also support with community linking as well. So if there are other issues going on outside of your mental health that could be really having an impact on how you're feeling at the moment, we can connect you to, so for example, social prescribing services, which would be able to kind of connect you to your local community, community groups, local activities, as well as employment support as well. So if you're experiencing any kind of work-related stress, you're looking for work, we have advisors that can help alongside that as well. As well as any other kind of financial, housing support, welfare, benefit advice, and also kind of social care support as well. We can offer those kind of referrals alongside of the treatment we offer. We also do run groups, so they're kind of similar sort of materials to the guided self-help sessions, but they're kind of structured psychoeducation sessions. So the main groups we're running at the moment is the kind of boosting your mood group for depression, managing worry, stress management, and sleep as well. Usually there will be 5 sessions over the course of 6 weeks. And they can be quite useful with groups because it's a space where you can discuss these techniques of managing these mental health conditions amongst others that might be going through similar things. You can share experiences. So usually the groups can be quite a helpful space. And then lastly, we also have kind of online psychoeducational workshops. So at the moment we have stress and relaxation, assertiveness, perfectionism, low self-esteem, and these are kind of all accessible kind of online workshops that you can access at any time and watch them. Usually it would be for people that maybe kind of would be suitable for support, but perhaps might not be ready for that kind of one-to-one therapy, something that you can go and watch to get that support. We did use, that's okay. Just to say, we did used to offer a computerised CBT, which was online modules, but that isn't anything that we're currently running, so these would be the main avenues for support. So alongside of the guided self-help, as part of it, we also support people that have long-term health conditions. So these are just a list of sort of the main sort of conditions that we can adapt guided self-help to support with. So diabetes, chronic pain, cardiovascular disease, respiratory conditions, as well as long COVID. So what that looks like is we have kind of clinicians that are trained in understanding these conditions, so we would be able to offer psychoeducation about your condition, and also thinking about that mind-body connection, so how it might be impacting your mental health and vice versa, and adapting the guided self-help tools to just sort of help with, alongside of your condition. So for example, our treatment with depression might encourage you to engage in sort of valuable, meaningful activities within the limitations of your health condition as well. We also kind of think about problem solving, so supporting you to overcome any kind of condition-related challenges, as well as running groups. So we have a managing pain group, a long COVID group, and a living well with LTCs group as well. And then lastly, just signposting as well, so kind of connecting you with other services, other health services that can support with your physical health condition, like we have the expert patient programme, recovery college, so just moving in with other services as well.
How do you refer to us? So we brought along 2 ways that you can directly refer to us if you wanted to today. We've got leaflets with a QR code, and for anyone not comfortable using the QR code, there's a form where you can fill in your information, or if you prefer to speak to someone on the phone, you can call this number. These will all be sent out to you, and we can also support you if you need help today. You can also ask your GP to refer to us. So for our step 2 treatment, when anyone enters the service, we would offer them an initial assessment. But first of all, we would make a decision on whether the referral felt like it was right for our service, but we would always get back to the person if we felt that wasn't the case, or we would refer on to one of our secondary care services. Then after about 2 weeks from referral, we would offer an initial assessment where we would get to know more, in your own words, about the main difficulty that you're experiencing. And if that was suitable for step 2 treatment, you'd be put through to the treatment waiting list, which we aim from assessment to be about 6 to 8 weeks. If it was step 3 treatment, which is what I offer, which is the kind of full course of therapy with longer sessions, that is a longer wait, and I'll be really transparent with you. That's a 6 to 8 month wait, but we are really working hard to get it down. We also offer groups where you can be seen quicker. So our minimum age is 17 and a half years old, and we have no upper limit on age. Yeah, I think that's everything, but I'm really happy to answer questions.